everyone, and welcome to the MEGIN Spotlights, where we shine a light on the people and organizations driving innovation in neuroscience and brain health. I'm your host, Nicole Sourry, and today I'm thrilled to be joined by Dr. Svetlana Pinet, researcher at the Basque Center on Cognition, Brain, and Language, also known as BCBL. BCBL recently partnered with Meta AI on a groundbreaking project that used non-invasive MEG brain scanning to begin decoding brain activity into written text. Svetlana, welcome to the show. It's wonderful to have you here. To kick things off for our listeners who may not have heard about this yet, what's the big idea behind your collaboration with Meta? What were you aiming to discover or achieve with this project?
Thanks. Well, I think the main goal of this project is really to understand better how we are able to do language, right? This is an amazing human ability that we are able to use words and form sentences and create new sentences that no one has ever said before. And in language, we know a lot about perception, how we hear sentences, how we understand them, but not so much about production, maybe because perception is somewhat easier to study. So that was really one of the goals, to focus on how we produce sentences. And there's a double goal, because if you understand it better, you can also develop applications for clinical patients.
So this leads us to our next question. What exactly did participants do during this study, and how did you go about training the AI models?
So participants were typing sentences. They were seeing words on the screen, and they had to remember them and then type them out. And so that was really a simple task, and they just had to do that for an hour or so. And then we trained the models using some decoding algorithms. So this is really taking some pattern of brain activity and the associated response. For instance, saying, well, this is what the brain activity looks like when someone types an A, the letter A. And then you do the same for the letter B, etc., etc. You train the model on all of the letters, but you saved some of the data for later. And so once you've trained the model, you can test it with the remaining data. And so this time you don't tell it what is the letter that is being typed. You just give the data to the model and see whether it can guess right what is the letter. So I've explained this for letter, but we also do that for the syllables, for the whole words. And so this is really how we go about training the models.
Can you tell us the outcome of your collaboration?
Yeah, of course. So we actually have two different studies, right? We're publishing them at the same time because we feel that they're really complementary, right? So one is really more about designing this BCI interface that has more clinical application, of course, not right now, but this is the door it opens to really be able to decode the characters that someone is typing from their brain signal. And here, well, we find that it can guess right 2 characters out of 3, right? 2 letters out of 3, which sounds good. It is good.
Yeah.
But it's still not that good, because if you're reading a text and only 2 out of 3 letters are right, it's going to be quite difficult to understand. So it's not perfect yet. We're very happy about it, but there's still a lot to do. And the other project is more really about the brain mechanisms underlying language, and here understanding how the different steps kind of articulate one with each other, right? So how, well, first we figure out the context of the sentence, and then we go down to the word level, and then you decompose the word into the 2 syllables, and then you go into the letters that are within each syllable. And so we're really able to find traces of this hierarchy and of each level of the hierarchy, and how they are really co-activated, and how the temporal scale also follows this this hierarchy, becoming more and more precise at the letter level and more narrow, while the activation is really more broad when we talk about the context, for instance, of the sentence.
That's really interesting. So many people are familiar with brain scans like MRI, but your team focused mainly on MEG and EEG. Can you walk us through what MEG is and why it played such a key role in enabling mind-to-text decoding? Why did you choose to use MEG over other modalities?
Yeah, well, MEG was really instrumental in answering our research question, actually. So MEG stands for magnetoencephalography. It records the magnetic activity of the brain. this activity is very, very tiny. So it has to be amplified a lot, and the machines are made for that. And what's good for us is that it has a very good temporal resolution. So we can really measure very precisely the pattern of brain activity and how fast it changes. And we expect it to change fast because when I'm talking right now, a lot of things are happening in my brain. And so we need this temporal resolution, this very, very precise measure to know what is happening to our brain activity and how it changes and evolves as we are constructing sentences, retrieving words, and putting them together.
So, since movement often interferes with brain scan readings, how did you manage to capture and interpret brain activity without movement from participants?
So this is where the trick to use typing came in. I've been working on typing for a long time, and when we wanted to study language production, it became very, very useful because when we are producing language, when I'm talking, the movement of my jaw, of all the articulators, it creates a lot of muscle activity that can also be recorded by the MEG scanner. And so that creates a lot of artifacts in the signal and makes it harder to analyze. But when you're typing, well, the motor activity, there's also some motor activity, but it's further away from the brain. And so that allows us to have people still produce language through typing without being without having all of this interfering motor activity.
So, from your perspective, what are some of the biggest challenges at the intersection of artificial intelligence and neuroscience?
Well, that's a very big question, right? I think we are living very exciting times because artificial intelligence is moving really, really fast. The models are evolving really fast. And so we really want to understand how much in common we can find between artificial systems and human brains. So right now, it's been really helpful to understand how human brains process information. And at this moment, we're really trying to see how far we can push this idea to really compare the two. But honestly, we're making baby steps, right? To really develop interfaces that will be able to decode the intention of communicative in a non-invasive way. And that's important because it's much safer than if you use surgical procedures, right? So that's the goal for us, but also we have to keep in mind some of the ethical challenges that are associated with the pursuit of reading people's mind. We're definitely not there yet. But if that's the end goal, we have to keep also ethics in mind.
Looking ahead, if we leap forward 10 years, what's your vision for the future of BCIs and human communication?
So now we have the proof of concept, let's say, but there are many steps ahead. So for instance, the next steps can be removing information little by little when we're training the models. So for instance, can we make a model work when it doesn't have information about the time of the keystroke? Can it work if we remove the information about the rest of the sentence? Can it work if we remove the information about who is typing? So there are all of these that we are working on.
Are there any further projects in the pipeline that you can share with us?
Well, of course, we're still pursuing this line of work at the moment. I'm not sure how much I can really share at the moment, but we have many more questions to answer. Really, this was just a first step, and we are very excited by the prospects that it opens.
So, Svetlana, thank you so much for joining us and giving us a fascinating look behind the scenes of this cutting-edge research. It's been a pleasure speaking with you today. Thank you.
Thanks.